Welcome to Learners Hub Vellore. Hope you're all doing great. In today's session, we will see more on erythrocytes, or you can call it as red blood cells. The erythrocyte. Eryth means red. Cyte means cell. In normal, there are about 5 million, that is 50 lakh red blood cells per microliter. Red blood cells are non-nucleated formed elements in the blood. Red color of red blood cell is due to the presence of hemoglobin. Erythropoietin is a hormone secreted by the kidneys in response to produce erythrocyte. So, where is erythropoietin secreted? It is secreted by the kidneys. Why it is secreted? It is secreted to produce erythrocyte. Seeing the normal range, in male it is about 4.5 to 6.0 million cells per cubic millimeter. In females it is about 4.5 to 5.0 million cells per cubic millimeter. Coming to the structure of a red blood cell, this is the top view. Diameter of a red blood cell is about 7.2 mu meter. This is the side view of a red blood cell. Thickness of a red blood cell is about 2 mu meter. Morphology of red blood cells. Normal shape of red blood cell is biconcave. They have thicker edges and they are thinner at the center. In center it is very thin. They are usually circular. Red blood cells with normal shape are known as normocytic. Normo means normal, cell means cyte. Coming to the size. Red blood cells have size that is 7.2 mu meter in diameter. Thickness of cell is about 2 mu meter. We have seen it earlier. The shape and size of red blood cells varies in diseased conditions. Matured red blood cells do not have nucleus. They lose their nucleus at maturation. In diseased conditions, nucleated red blood cells can be seen. What is Rolo's formation? Red blood cells have the tendency to collect together like a pile of coins. The red blood cells, they collect together like a pile of coins. That is known as Rolo's formation. Color. Hemoglobin plays an important role in the transport of respiratory gases and facilitates the exchange of gases within the fluid outside the cell, with the fluid outside the cell. So you can call it as tissue fluid, for example. The unstained RBCs. In unstained RBCs, which are seen under microscope, they show greenish yellow color at the edge. And in the center, they show a pale depression. Coming to stained RBCs, that is Romanowski stains, red cells, they take a pink color. The periphery is darkly stained and the center pallor, you can call it as palely stained. In some hemoglobin deficiency, the staining may be pale. Red blood cells which have a normal color is sometimes known as normochromic. Normo means normal, chromic means color. Coming to the functions of red blood cells, they carry oxygen from lungs to the tissues. They carry carbon dioxide from tissues to the lungs. That is in the process of inspiration and expiration. They maintain acid-base balance. They are biconcave in shape. They are flexible and they can pass through the capillaries. As they don't have nucleus, they have no need to synthesize protein. They carry blood group antigens like antigen A, antigen B, and Rh factor. Why are they helpful for? This helps in the determination of blood group and they enable us to prevent the reactions due to incompatible blood transfusions. The lifespan of red blood cells is about 120 days. Polycythemia. What is polycythemia? Increased red blood cell count is known as polycythemia. What are the causes of polycythemia? Age, low oxygen level, heart disease, heart failure, high altitude, lung disease. Nicotine addict. This is seen in smoking people, dehydration, kidney disease, bone marrow overproduction, cancer. Now coming to erythropenia. The decreased red blood cell count is known as erythropenia. What are the causes of erythropenia? Anemia, bone marrow failure, hemolysis, leukemia, malnutrition, multiple myeloma. What is multiple myeloma? It is the cancer of plasma cell. Pregnancy, thyroid disorders, chemotherapy. Now coming to the variations of red blood cells. Size, variations in size of red blood cells. Under physiological conditions, the size of red blood cell in venous blood is slightly larger than those in arterial blood. In pathological conditions, the variations in size of red blood cells are microcytes. Micro means small. Macrocytes. Macro means larger. Anisocytosis. These are the cells of different sizes. Coming to microcytes, it is mainly due to iron deficiency anemia, prolonged forced breathing, increased osmotic pressure in blood. Macrocytes. In macrocytes, megaloblastic anemia. What is megaloblastic anemia? It is a condition in which the bone marrow produces unusually large, that is structurally abnormal immature red blood cells, muscular exercise, decreased osmotic pressure in blood. Anisocytes. They are found in pernicious anemia. What is pernicious anemia? It is a decrease in red blood cells when the body can't absorb enough vitamin B12. This is also called as Addison's anemia. Variations in shape of red blood cells. Shape of red blood cells is altered in many conditions, including different types of anemia. Coming to crenation, shrinkage as an hypertonic condition. Spherocytosis, globular forms as an hypotonic condition. So what is hypotonic? It has lower concentration of fluid, sugars and salt compared to blood. That is hypotonic. And what is hypertonic? It has higher concentration of fluid, sugar and salt compared to blood. So this is the difference between hypertonic and hypotonic. Elliptocytosis, elliptical shapes in certain types of anemia. Variation in shape, sickle cell anemia, crescentic shape as in sickle cell anemia. What is crescentic shape? Just remember a crescent shaped moon. More or less it will be like that only. Poikilocytosis, unusual shapes due to deformed cell membrane. Hope you all enjoyed this session. In our next session, we will focus on white blood cells. Thank you for being a good listener to me. Stay tuned for our latest updates.